And we're very fortunate to have our retired physician, also founder of Health Watch USA, Dr. Kevin Kavanagh. Good morning, Dr. K.
Good morning, Jack.
How is Health Watch USA? Are you getting growth during this pandemic? We haven't really talked about that.
Oh, we really are. We had a meeting last night. We had a large amount of individuals on there from all over the nation. We had the Massachusetts Teachers Association talking about school safety, the importance of ventilation, and how to get your school systems geared up. And so we're really looking at a bunch of different topics within this pandemic, and we do have an awful lot of members at this point.
And you started this a number of years ago, so it didn't have anything to do with the pandemic. Why did you found this? What was your inspiration?
Well, Jack, a lot of this had to do with patient safety, and I felt that we could be delivering better medical care and putting better resources into the care that we're delivering to patients. And this isn't on a physician level. This is on a system-wide level, that it appeared to be very top-heavy onto where resources were going. And we really focused on infections because we had seen infections creeping up, especially with MRSA. And this is what we've specialized in, or at least concentrated our activities on for the past decade. And this is why this pandemic is kind of right up the interest of our membership.
Well, you have been so nice since the beginning of this outbreak to spend a great deal of time with us, bringing us up to speed on what's going on. So where do you want to start this morning?
Well, I think the vaccine would be a good place. As you know, we've got additional data out from Pfizer, which is just phenomenally good. I've had a chance to look at it, and they are looking at efficacies of 94% in the elderly, which of course I fall into that category. And I was very scared initially that this might be like the flu vaccine, where the initial study showing good effects in younger people, well, the older people, they may not be as responsive to the vaccine, kind of like the flu vaccine. You need a larger dose. Well, apparently that's not the case. This is also very effective with the elderly. And the other big thing is that there's also data out that it's preventing severity of illness. In other words, your chances of being hospitalized or dying. So this vaccine is extremely effective, and I think it will be a godsend if they can get production geared up. Now, the other vaccine out there from Moderna, that vaccine is a similar methodology. They're giving out similar types of results, and I think that that also will have efficacy that is beyond expectations. So we are almost there. We just need to hunker down a few more months until we can get this vaccine.
And I heard a report this morning that AstraZeneca has one that's not too far from asking for approval. Do you know much about that one?
Well, that's, I believe, the one with Oxford, and that's based on an adenovirus as a delivery mechanism. And I really feel that that will probably also have very good results. The technology behind these vaccines is just phenomenal. One of the things you need to realize, Jack, is that they've got down to the very amino acid, the types of spike proteins and things that are on this virus, where the most effective area is for the antibodies to hit and to kill the virus. And that is the area that they're potentiating in the vaccine. So unlike messaging from some of our leaders, or at least one of our leaders, the vaccines are probably much more effective than your immunity. Because immunity, you make your immune cells to just everything on that virus. This vaccine targets just the specific area of the virus that will kill it. So it is a very, very effective type of a mechanism. And you get 2 doses of the vaccine, which would be kind of like equivalent to getting 2 severe, very severe infections. And of course, if you have had a mild infection or asymptomatic, your immunity may not be nearly as great. So the vaccine is the way to go. Let's get this.
In the meantime, the CDC and the governor have both issued some instructions. And let's start with the governor and his announcements on Wednesday.
Well, those announcements were pretty much in line on what we discussed on Tuesday. That is the closing of restaurants, closing of bars. And I feel that that just needs to be done at this point. We are skyrocketing to the point beyond my imagination, to be honest with you. I never thought we would get to this point. And when I say closing, I'm talking about indoor services. Outdoor services, pickup, delivery, that's still open. So I do think that that is wise to do. There is good data behind this. A recent study out of Stanford that used cell phone data tracking people who develop COVID to where they've been. Restaurants are way out there. They are number one, much higher, for example, than churches. Churches are still a risk factor, but I'll be honest with you, I think many churches have figured out how to have services safely. And because of that, they're a lower risk factor than restaurants. But at this point in time, churches, I believe, if you can't hold your service online, or for example, in the parking lot, it's probably best to close down until we get over this very large surge. Because remember, we do not want to outstrip our hospital systems.
Right, but now that is what the governor has suggested to churches. It's not a mandate, but he has asked that between now and the date in December that the churches do cease in-person services and go online.
Yes, correct. And I would ask that too, because I live in a community. You know, it's not just the people in your church. They can go out and then spread the virus. And also, church services, there are a lot of elderly senior citizens in those services. So, you know, we've got to be careful. We need to protect those that are very much at risk. And believe me, right now, protection is obeying public health advice and avoiding large gatherings or even medium or small gatherings, which brings us into Thanksgiving. That is also problematic.
Right, and the CDC has now flat out asked people to just not travel for Thanksgiving, right?
Correct. And travel is a problem, not only when you're on the bus or the airplane or even in the car, it's when you have to stop, when you have to go to the bathroom, when you're in the large gathering areas or the hubs. That's where transmission is the greatest. And so it is a risk. And when they talk about your family unit or your household, according to the CDC, that does not include your children who are off at college, because they will bring things in, or family members that are serving in the armed forces. So you want to be sure that your household that you have is just the people that you live with. I believe the governor has limited that to 8 people and possibly 2 households. As I said on Tuesday, we're not doing that. We're just staying within our own household, and we're going to do kind of takeout, each making a portion of the dinner and then swapping, and then getting together over Zoom or other telecommunication apps or whatever, and enjoying each other's company. Or we're also going to try to play a game online, such as Clue. You can even play Monopoly. So there's a lot of family events you can still do together using telecommunications.
Okay, a couple of texts here, and then we're going to take a break. Bill says, from day one of COVID-19 through now, I don't think I've heard one thing about boosting your own immune system by eating healthier, exercising, taking supplements, etc. Any thoughts on that, Dr. K?
Well, I think that's very important. We've touched on it on a really, well, just very lightly, and that has to do with vitamins. As you know, vitamin D and zinc is very popular. Some people think that higher levels will help you. We've just encouraged people to make sure you're not in the low category of that. So yes, you do need to maintain your health. You want to try to get good sleep. By all means, exercise. You don't want to put on COVID pounds, because I'll tell you, the highest risk factor for severe COVID-19 is obesity, and staying at home is certainly going to make that more likely to happen, especially if your wife is a good cook.
Yeah, there you go.
Yeah, and I should add with Thanksgiving, my wife's the cook, so I'm not impacted nearly as much.
Jim asks, can you ask the doctor if masks are so effective with latest stats showing over 90% of us wearing them? Why do we have a drastic increase in cases?
Well, I don't think in Kentucky 90% are wearing them. People aren't necessarily wearing them correctly, and they're really not so effective. They help. That's the key. You still have to social distance. You can't gather. And so if you put a mask on and it decreases your chances of getting the virus, let's say by a factor of 6, but yet you go out and you interact with people and take part in a bunch of really dangerous activities, you've become now in a higher risk category than if you were social distancing at a big distance and didn't wear the mask. So they're a layer of armor. That is it. And we're also worried about people gathering at home, gathering with their friends where they don't have masks. And I see this all the time when I walk around the neighborhood. You have different neighbors talking to each other. They're not wearing masks. They're gathering because they're their friends. Well, they can transmit the virus too. And that's where a lot of the transmission is occurring. And it's also occurring during restaurants and bars because it's hard to eat and drink and wear a mask at the same time. And people tend to eat and then they talk, but they don't put their mask on.
Mark, good morning. You're on the air.
Thank you. Yeah, I had a question. I heard you say a few minutes earlier about, senior citizens going to church and how they're at risk. And one of the things that runs through my mind, and I hear other people that I know bring this up, was why do we need to tell them what's best for them? Why can't we let them make that decision for themselves instead of telling them what's best for them?
Because it's not just their decision. It's kind of like drinking and driving. It's like going to say, well, if you drink and you kill yourself while you're driving, that's that person's fault. Well, the problem here is you're spreading it to other people. This pandemic is because of the viral spread. And I'm telling you, all of the theories that we've discussed over the months and months over how this virus isn't that dangerous or isn't this dangerous, et cetera, well, first of all, those aren't valid, but you can throw them out the window if our health system's overrun. North Dakota has the highest death rate now for coronavirus in the world because they've outstripped their healthcare system. So we've got a couple of problems here.
Let's go to Jim, Dr. K. Hello, Jim.
Yeah, doctor, three things. The chemtrails, the air, are they injecting this stuff into our system, our air system around the world? China, are we sure that they've stopped trying to put, send people in maybe to bring this virus over here? I think that's been on my mind. It's kind of like when you're in a boat and it's sinking. Do you want to, bail it out, or do you want to fix the leak first? And also the borders. Why haven't we talked about shutting the borders down? Because if people are coming across the borders, bringing this stuff in, that's not stopping it at all.
All right, I'm going to let you listen off the air. How do you respond to that?
Well, the first one's a hard no.
Yeah.
That's on the chemtrails. I don't think that that's a factor. That to me is not really scientific based anyways. As far as China, is it involved? Where did the virus come from? We've discussed that. I really can't tell you. I mean, that you'd have to have someone from the National Security Agency on there. But certainly from the data that I've seen, the current data, they know the genetic makeup down to the amino acid and the single amino acid you have to switch to make different types of viruses. And sitting in labs are different types of mutations of this virus. So knowing that, and that's been published in peer-reviewed journals, any type of theory is possible. So we'll leave that up to national security. Now, as far as closing the borders, I hate to tell you all this, but we've been kind of in the reverse situation here. We can't go to Canada, all right? So the borders have been closed, although we haven't closed them. That, however, does get into that you have to have a uniform, strategic, national plan and coordinated effort. In the beginning, and this was a good decision, we closed some of the travel from China, which probably should have been done earlier. Doesn't matter, it still helped. But we didn't look at the Northeast, and the virus came in from Europe. And so when you look at closures, or you look at what strategies do we have to do, it really needs to be on a national basis. You can't play whack-a-mole and get a hold of the virus. You can't dial it. It's like a freight train. By the time it gets to your community, it's too late. It'll keep on going for weeks. So national strategy is key, and hopefully we'll be able to have that in the next couple of months.
Here's a text. Let me see who this is from. I think we've got a name. This from Dave. Bashir's Kentucky Health Commissioner was on WKYT last night talking about gatherings of more than 8 in close proximity. Your guest just validated my complaint. Why is there a basketball game at Rupp Arena? And in my opinion, it's very hypocritical. So, again, that's not a decision, Kevin, that you made, obviously, but it does seem strange.
Well, it is. The virus doesn't care the setting. And I think we're going to see this more and more now that it appears we're going to have a change of administration. Is the messaging going to be different, or is actually the actions going to be different? And I believe that sports are something that we can put on hold for a couple of months. Gatherings are gatherings. And the problem with sports is that people are screaming, they're shouting, and that will aerosolize the virus. And if the virus aerosolizes, it can float in the air, it can live for hours, spreads much farther than 6 feet, and it can defeat the cloth mask. And God forbid if you bring up goggles, but for sports, I think goggles, masks, and a hazmat suit. And if you want to do that and be in a sports arena, well, I guess that's okay, but that's not really realistic. I don't know how you can do sports safely at this point.
Yeah, not too practical. One more call, Eric, real quickly.
Good morning, man. I was curious about the big box stores and the grocery stores. Seems like we see very little disinfecting going on, and there's no emphasis on that. Thank you, guys.
All right. What do you say, Kevin?
Disinfecting is important, but we're learning that contacts from surfaces is maybe 5% of the spread. And I'm just pulling that number out from a talk that I've heard. What they're really concerned about now is aerosolization in air, ventilation and quality. We've been talking about that since August, and we really do need to upgrade the air ventilation systems, but still at the same time looking at contact surfaces. Should note, Amazon, new distribution center, 500 more jobs. People are ordering online, and I think that type of a behavior is going to continue even after the pandemic goes away. I think people have discovered online shopping and the convenience of pickup.
Do you think that the 3-week period is going to give us enough time to get a handle on this thing?
I hope that it will. Of course, even if we stop now, we've got 3 to 4 weeks of increasing hospitalizations, ICUs, and deaths. But we do need to get buy-in from the public. Right now, it's not the virus, it's the danger. It's the mismessaging and the misinformation that we're hearing from some of our leaders and getting people who believe in those leaders to follow when it's not correct. And you can see now with your own eyes what's happening. So we do need to follow public health advice. If we do that, this virus could go to very low levels and we could return to a safe type of environment and have an Easter that is absolutely fantastic with your family.
Thank you, Dr. Kevin Kavanagh. Stay with us.